Okay, so next if we have ankylosing spondylitis, and this is kind of how axial spondyloarthritis progresses at the next stage. In this table, we can see that sacroiliitis was only evident on MRI in axial spondyloarthritis. However, in ankylosing spondylitis, we'll have bilateral sacroiliitis on X-ray or unilateral sacroiliitis on X-ray. That is how the imaging will be given to us. On history, we will not have all of these four things. We can only diagnose it with lower back pain that is for more than 3 months, and it is improved by exercise and it is not relieved by rest. In clinical examination, we'll have limitation of lumbar spine movement in sagittal frontal planes, and chest expansion is also reduced because, of course, the ribs are also attached with the spine. And we'll also have Schober's test positive, that is that we'll have to measure back in flexion and extension posture. Okay, and in ankylosing spondyloarthritis can be diagnosed on X-ray evidence of sacroiliitis given on the feature on the history or examination. We'll only have to go with improved with exercise and not relieved by rest, which are also the first 2 points given in the axial spondyloarthritis, and we don't have to think about other points in diagnosing axial spondyloarthritis. So, about the introduction, ankylosing spondyloarthritis is defined by the presence of sacroiliitis on X-ray and other structural changes on spine X-ray, such as which may eventually progress to bony fusion of the spine. There is male to female ratio about 3:1. That means this is predominantly a male disease. In Europe, more than 90% of the affected are HLA-B27 positive. More than 90% are HLA-B27 positive. Caucasian HLA-B27 population prevalence is 9%. So this is not sure that HLA-B27 will always be linked with ankylosing spondylitis. The overall prevalence of AS is below 0.5% in most populations. However, 75% of patients are able to remain in employment and enjoy a good quality of life. Even if severe ankylosing develops, functional limitation may not be marked as long as the spine is fused in an erect posture. Okay, so functional limitation is not marked as long as the spine is fused in an erect posture. If the spine gets fused in stooping posture, then there may be problem.